Hello, I'm Scott Gilbert, and I'm the Fellowship Director of the Nephrology Fellowship Training Program at Tufts Medical Center. We're excited to share with you our program today and demonstrate how we can prepare you for the career of your interest. We have exceptional faculty, we have incredible facilities, we have a thoughtful program designed to help you launch your career.
We feel very strongly about the training of our fellows and where they're going, and trying to create the best environment so that they become the best physician and, of course, a happy physician in the future. I think we have a lot of areas where we have a lot of expertise and we're able to really mentor the fellows well. In peritoneal dialysis, polycystic kidney disease, glomerulonephritis, cardiorenal syndrome.
The exposure to dialysis here at Tufts is really one of the highlights and true strengths of our program, and it's something that's pretty unusual among nephrology training programs. Both hemo and peritoneal dialysis exposures are continuity experiences.
We don't just have a month or two of dialysis in which you marinate yourself in the dialysis unit. You have a year of dialysis. You have a group of your own patients. You get to know them. You get the fun out of taking care of them. Our outpatient clinic is on the 4th floor. The dialysis unit and Dan Wiener's and my offices are on the 5th floor in between. And so it's just one floor down from their offices for the fellows to go to see their patients.
We have a large home program, a few home hemo patients, mostly peritoneal dialysis patients, and every fellow that I've worked with really highlights working with these patients and learning how to help these patients meet their goals over a long period of time, over that entire year, as one of the more rewarding parts of their training.
So our fellows are exposed to just a broad range of nephrology cases, both inpatient and outpatient, and we have a very large emphasis on the outpatient ambulatory program. PKD is the most common hereditary kidney disease, and it's the 3rd most common cause of people to end up on dialysis or transplant. So I think it's important fellows get exposed to the depth and breadth of the range of issues associated with polycystic kidney disease. We've also participated in all the major clinical trials of drugs for polycystic kidney disease and are experts on using the one approved therapy that's now available for PKD. The teaching around PKD makes this program special and unique because patients know they're going to get expert care.
We are highly regarded for having contributed extensively to understanding of chronic kidney disease. The work we do has real-world implications. That's one of the things I so appreciate and feel privileged to be able to participate in the work that I do. I work on teams with epidemiologists, statisticians, clinical chemists, and our role as the nephrologist, as the clinical researchers, to make sure that all these wonderful, excellent methods, make sure that we can translate them for the patient, for the provider.
So Journal Club is one of the weekly conferences we have here in the division. We like to pick an original research article because that's what's new, and we also want to be sure that our fellows are well trained in being able to read original research articles. It's not just for what's a new treatment or what's a new disease or what's a new lab test. It's how did the person go about crafting the experiment to test the hypothesis, and how do they tell the story as to what this means for medicine.
So I will talk about my personal experience as a fellow at Tufts. I loved it. And if I'm asked to do fellowship again, I would choose Tufts anytime. That's how great my fellowship experience was. We have structured our fellowship program in a way that you have a balance where you have enough outpatient experience, and that applies to all aspects of nephrology, including transplant. The way we have structured our transplant rotation over here, we have our fellow rotate through all the aspects of the transplant. They do donor evaluation, recipient evaluation, they go to HLA lab and spend time with HLA lab director, and that's one-to-one meeting. That usually doesn't happen at a busy program. And they have post-transplant follow-up clinic where they provide continuous care to the post-transplant recipients.
We have a lot of interesting cases, both in the clinic and also in the hospital. and our program makes a lot of effort to get the fellows connected to those cases. We have a multidisciplinary team for thrombotic microangiopathies, including myself and another nephrologist, individuals from hematology, people from the blood bank. We're establishing and growing a multidisciplinary glomerulonephritis clinic. I think the key is if the fellows aren't involved with these cases, we haven't done our job, because this is what they really want.
We think it's really important for fellows not just to understand how things were done last year or 10 years ago, but anticipating a little bit how they're going to be done tomorrow and in 5 years. I think ultrasound is extremely important, and so we have a multi-part curriculum under development, both to teach fellows about ultrasound of the kidney, but also to teach fellows about hemodynamic evaluation and cardiovascular evaluation. And for that second part, we are dovetailing our curriculum with that of the critical care instructors, who are going to let our fellows participate in their lectures, in some of their standardized patient reviews, and the rest of their online curriculum.
You work hard here, let's face it, but that's good in the end because you're well trained. But we always hear this about our fellows, like people are really impressed with how they can just ease into this job and perform really well.
I'm very proud of this place. I think we've created a great opportunity for our fellowship, and it's a good place to work.
We work well together, we have a lot of respect for each other, we care for each other, we assist each other as we each perform the incredible work that we do.